Welcome to this PoCUS video where we're going to talk about eFAST, Extended Focused Assessment with Sonography in Trauma. My name's Aaron, I'm an A&E registrar working in the UK. So eFAST is used in trauma patients to identify free fluid. It's important to remember that this isn't necessarily blood, although in trauma you're probably going to assume that it is blood. It's very similar to Focused Assessment for Free Fluid, or FAF, that's used in medical patients. With all PoCUS, we should really have a binary or focused question that we want to answer. And in this case, the questions are, is there any free fluid? Yes or no. And is lung sliding present? Yes or no. It's important to remember that free fluid may accumulate differently depending on gravity. So a patient who's walked in may have fluid in a different space to patients who have been lying on a trauma board for a prolonged period of time. In experienced hands, it may be that less than 500 mils of fluid is missed, but a lot of studies would suggest that up to 500 mils of fluid could still be present before it's seen on ultrasound. Therefore, it's important to consider this test a rule-in test rather than a rule-out test, meaning that if you see free fluid, then you know free fluid is there, but if you don't see free fluid, then it could still be there and you've just not seen it. There are no absolute contraindications for performing this scan, but just consider whether performing the scan might result in a delay to either further investigation such as CT or management such as transferring to an alternate centre, surgery or interventional radiology. The curvilinear abdominal probe should be used. This is a low frequency probe that results in higher penetration into the body, but at a cost of reduced resolution, so the picture quality isn't as good. It's got a very large footprint, and that can be tricky, especially in the right and left upper quadrant views where rib spacing can be a problem and obscure the view. 5 views are required to perform this scan. The first 4 are the right upper quadrant view, the left upper quadrant view, the suprapubic view, and the subcostal view. All of these views looking for the presence of free fluid. And then there's one extra view that's been added in what is called eFAST or extended FAST, and this is the pleural view or the anterior thoracic view, which looks for the presence of lung sliding. So in the right upper quadrant view, free fluid needs to be looked for in 5 potential spaces where it can accumulate. So from top to bottom, these are the pleural cavity, the subdiaphragmatic space between the diaphragm and the liver, Morrison's pouch between the liver and the kidney, the tip of the liver, and the inferior pole of the kidney. Here we can see the probe placed on the right upper quadrant with the marker pointing towards the patient's head. The exact position to place the probe may depend on patient's anatomy. Sometimes the probe needs to be moved more anterior, sometimes a bit more posterior to get the optimal view. Remember, we need to interrogate the views that we see here in all potential spaces. So there's 5 spaces where free fluid can accumulate. So these are from top to bottom again, the pleural cavity above the diaphragm, between the diaphragm and the liver, which is the subdiaphragmatic space, between the liver and the kidney, which is Morrison's pouch, at the tip of the liver, and then finally at the inferior pole of the kidney. For the left upper quadrant view, there are 5 spaces to look for, and these spaces are the same as in the right upper quadrant view. So on the left side, these are the pleural cavity, the subdiaphragmatic space between the diaphragm and the spleen, the splenorenal space between the spleen and the kidney, the spleen tip, and the inferior pole of the kidney. Here we can see the probe placed over the left upper quadrant, a bit more posterior than needed for the right upper quadrant, again with the probe marker towards the patient's head. In the ultrasound image here, we can see the pleural cavity where fluid can accumulate. We can see the diaphragm, therefore we can see some of the subdiaphragmatic space between the diaphragm and the spleen. We can see the splenorenal space, we can see the tip of the spleen. However, we're just missing the inferior pole of the kidney, so it would be important to move the probe slightly down in order to visualize this area as well. For the suprapubic view, 2 views are required. The first one is the transverse view, so here the probe is placed low down over the bladder with the probe marker pointing towards the patient's right. And secondly, the longitudinal view, where the probe is rotated 90 degrees so that the probe marker points towards the patient's head. This view is commonly misinterpreted because of alternate forms of fluid, such as in females, physiological free fluid. And it's important to remember that the anatomy is different for both males and females. In these ultrasound images, we can see the transverse view of the bladder in both male and female patients. In the left image, we can see the bladder is full of anechoic urine, and just posterior is the space where we would look for free fluid. In the right image, we can see there are 2 potential spaces where free fluid can accumulate, but both of these are posterior to the bladder. So essentially, you just need to look posterior to the bladder to look for any anechoic free fluid. In these images, we see the suprapubic view, with the probe held longitudinally. And again, we want to look posterior to the bladder for any anechoic free fluid. Remember again, in females, in the right-hand image, there are 2 potential spaces where this free fluid can accumulate. For the subcostal view, the probe is held with the probe marker towards the patient's right if the abdominal setting is being used. However, the cardiac probe can be used instead if preferred. However, it's important to remember that this will likely require that the probe marker should point towards the patient's left. In the ultrasound image here, we can see all 4 chambers of the heart with a hyperechoic pericardium surrounding it. Anechoic fluid should be looked for within the pericardium surrounding the heart. For the pleural or anterior thoracic view, the probe is placed on the anterior chest and lung sliding should be looked for. This will appear as if the pleura is shimmering, often referred to as ants crawling back and forth over it. M mode or motion mode can be applied if it's unclear whether there is lung sliding. The presence of lung sliding means that there is no pneumothorax. However, it's important to remember that the absence of lung sliding means that there could be a pneumothorax. However, a lot of other pathologies also cause this. In this video, we can see normal lung sliding, where the pleura appears to shimmer as if ants are crawling back and forth over it. For each of these images of the lung, on the left we can see the B mode with the M mode marker placed down it, and on the right side we can see the corresponding M or motion mode image. So in the left hand image, taken from a normal lung, we can see what's referred to as the seashore sign. In the M mode part, we can see that the lung is moving and produces a wavy type appearance, contrasting with the static appearance of the chest wall. So this is normal. In the right hand image, however, taken from a patient who did have a pneumothorax, we can see on the M mode part that the lung does not appear to be wavy as it does in a normal lung and appears very static looking, just like the chest wall, and this is referred to as the stratosphere sign and indicates the absence of lung sliding. So in summary, eFAST is used in trauma patients looking for the presence or absence of free fluid. 5 views are required, and remember the binary or focused questions. 1, is there any free fluid, yes or no, and 2, is lung sliding present, yes or no. And finally, thanks for watching, and please check out the individual videos that go through each view in turn.